Good afternoon, and thank you all for joining us today. My name is Mark Seifert, Solutions Advisor for the Center for Professional and Executive Development. And I'm excited to have you with us as we hear from Dean Vallabh Sambamurthy about digitization and the future of healthcare. So before I introduce Dean Samba, I'd like to share a few words from our sponsor, the Wisconsin School of Business Center for Professional and Executive Development, or CPED. So Dean, next slide. So CPED offers online and in-person programs and certificates that will give you the modern, relevant skills needed to advance your career. All of our programs offer interactive learning sessions facilitated by instructors with practical business experience. CPED also partners with organizations to provide customized professional development programs, coaching, and consulting. So for more information on the Center for Professional Executive Development, please visit us at uwcped.org. Sam, if you can go to the next slide. So with that, our center is actually in the midst of a longer-term strategy that will include a deeper focus to expand our relationships and partnerships within the healthcare industry. And our goal is to further understand and support the individual and organizational development needs of our healthcare partners in Wisconsin and across the U.S. Today's webinar on digitization and the future of healthcare is a small piece of a larger module we facilitated as part of a Healthcare Leadership Academy program we've designed in partnership with the Wisconsin Hospital Association. This page here bullets other topics that are included in that series. So if you're interested in learning more about these topics or how we work together in facilitating these sessions, or our longer-term strategy, I'd be happy to connect at your convenience. And at the end of the webinar, my contact information will be shared on the final slide. So getting to the webinar, if you do have any questions, sorry, Samba, if you can go to the next slide. If you do have questions you'd like to ask during today's webinar, you can submit those questions using either the chat or the Q&A buttons on the bottom of the Zoom webinar screen. We will pose questions that are submitted during the Q&A at the end of today's webinar. I also want to mention that today's webinar is going to be recorded, and a link to the recording will be made available within the next few days. So now I'd like to introduce our speaker. Dean Samba is the Albert O. Nicholas Dean of the Wisconsin School of Business, and a position he's held since 2019. He's a leading expert in how businesses compete in the digital economy, with his work being featured in leading academic journals. Several Fortune 500 firms have engaged him as a consultant, and executives and academic colleagues from around the world work with Samba in the areas of digital transformation, strategic alignment, governance, and innovation. So welcome, Dean Samba. We're excited to have you with us today, and I'll turn it over to you.
Thank you so much, Mark, and good afternoon, everyone, wherever you are. It's a great pleasure to share with you some of our perspectives on digitization in healthcare. Most of you who are listening in know that the healthcare sector is, if not the largest, among the largest sectors of the US economy, with as much as 19 to 20% of the gross domestic product. It's an industry that touches all our lives, and it's an industry that is continually in need of improvement, whether it be in terms of the costs of healthcare, the quality of service, the reliability of service. In other words, the healthcare sector is a perfect microcosm of every industry where businesses are focused on enhancement and improvement. But that's not the only thing that makes this topic important. Technology has begun to pervade this industry. In the last 10 years, one could say that the healthcare industry has gone from being a laggard relative to industries such as finance and retail to playing catch up to, in many ways, becoming a pioneer in the use of technology. So today, my conversation with you, based upon my research across different sectors, is going to be structured in two parts. First, we'll look at what's the promise of digitization in healthcare, and then we'll talk a little bit about, if the promise is so vast, what are the challenges? Why are firms still challenged with navigating digital transformations in healthcare. So let's start first with talking about what is digitization. It's a word that's important to recognize so that we're all talking about the same thing. And the way I define digitization is that it is a process plus technology plus data. Digitization itself is a huge challenge and opportunity for many firms, including the healthcare, because most healthcare organizations were built before the current technologies, such as electronic medical records or ERP, or any of the other technologies such as analytics. Now we're talking about wearables or IoT. And the challenge is, if we just simply throw new technology at an old organization or an old business process, we are going to be sub-optimizing the capabilities of digitization. So digitization really is about understanding the prevailing business processes and re-engineering them to take advantage of the technologies. It is about building more effective and efficient and secure access to data. So marrying process, technology, and data, that's the first step in many organizations. Converting the multiple forms of data into easy to use, integrative, and analyzable manner. Now, I will say digitization is not new. Many sectors of the US economy, including the healthcare, have been on the quest for digitization for the past 20 years. The early experiences were challenging, characterized with more mixed efforts, but today we have learned enough to know that we know how to make digitization feasible. But it's important to recognize that without digitization, it is not really feasible to think about some of the concepts that I will share with you today. Second important point to set scope around is, what are some examples of technologies that we are talking about? What you will see here is that the list will continually grow. And fundamentally, we need to ask ourselves, what technologies are relevant from the perspective of the delivery of healthcare, from the perspective of consumption of healthcare, and the perspective of paying for healthcare. And I will build upon these three perspectives as we go through this conversation. So examples of promising digital health technologies: AI and machine learning. We hear a lot about precision medicine, which is much more built around data. Artificial intelligence and machine learning has promise both for the clinical side of healthcare as well as the administrative side of healthcare, learning from data, augmenting our intuition with insights from data. That's the role of machine learning. And we'll talk about some examples. Wearables is a very promising technology because one of the growing trends is the patients wanting to not just enrich their relationship with their doctor and their healthcare insurance company, but also patients wanting to have greater ownership, if not control, over their healthcare decisions. Wanting to track some of their healthcare data and the ability to share that data with their providers to create a common platform for understanding treatment and health wellness. And so wearables are a very promising technology. The cloud, just like any other sector, is a very promising technology because the cloud brings data and treatment to the point of care, and it liberates hospitals and healthcare organizations from investing in costly physical infrastructure, because data can be stored more securely and it can be made available at the point of care. Electronic medical records, this has been a technology that's not new, but it has been challenging to implement But I believe that now more and more healthcare organizations are able to implement their workflows and electronic medical records to not only provide quality and consistency at the point of care, but also to improve the accuracy and the quality of the data around treatments. Blockchain is a promising technology in every sector because when done well, it will enhance our ability to curate, authenticate, and enhance the integrity of data and transactions. Given the sensitivity toward confidentiality in healthcare, blockchain will be a promising technology to balance speed and efficiency with integrity and security. The pandemic opened our horizons to not just the feasibility, but also the acceptability of telehealth as an augmentation to the traditional in-person healthcare. And so we will see greater acceptance and adoption of telehealth. And then, of course, there are promising opportunities available for in the space of virtual and augmented reality, whether it be in terms of physician training, whether it be in terms of expanding the reach of healthcare to places which are geographically constrained. So we're going to see some promising opportunities with these technologies. This is not to say that this list of technologies is definitive. It is certainly a list of technologies which are in the current conversation. And one of the implications of this is that leaders in the healthcare must continually be vigilant and be aware of these technologies, not from a pure technical perspective, but more from a what's the use case for these? Who's doing the experiments? What are the vendors doing? Are there other sectors in retail or financial services where they are developing some very innovative uses of these technologies in customer relationship or operational backbone that you can translate into healthcare? So it's an important aspect that one must be paying attention to. So why digitize? In the context of healthcare, I would offer that the digitization offers a path to the continued quest to enhance patient experience, to provide greater flexibility for patients and doctors, to provide real-time information exchange, and to reduce the costs of care. All of these continue to be important goals for the healthcare industry. So, what should we be focused upon in the context of today's conversation about digitization and the future of healthcare? Consistent with my observation in other industries, I'm going to spend some time by laying out the arguments that digitization provides a foundation for disruptions and transformations in healthcare. It does it for a couple of reasons. First, with greater digitization, we are seeing new players entering the healthcare industry. Soon I will characterize these new players as digital giants. These are examples of these are Amazon, Apple, Alphabet, just to name a few. And what's unique about them is they are cross-boundary disruptors. They have harnessed the power of data and technology. They built an organization which is more digital in its mindset, and they are looking for opportunities to enhance customer welfare in many sectors. Coming at this from an outsider industry perspective, they often have a disruptor mentality, and I'll talk more about what does that mean. But the second important aspect is today we know we have frameworks for discovering what I call the digital innovation sweet spots. So let me talk more about both of these ideas. So I said that there are incumbents and new players. How should we make sense of it? Ultimately, regardless of the industry, it's always useful to have a lens which says, what about your customer? Walk in the shoes of your customer, map the customer journey, understand the customer's pain points. So let's use that as a starting point for the conversation by saying that let's ask ourselves 3 questions. The first question is, and I apologize for the siren outside. In any business, a conversation about the customer must start with value proposition. Simply defined, value proposition is, what does the customer get from us? How do we build value in what we deliver to the customer? How do we build sustainable value that wants the customer to choose us over others? And we repeatedly enrich and enhance that offering and the relationship, which gives us a differentiated competitive advantage. That's essentially the heart of strategy. I'm going to build upon this by drawing upon the work of the late Professor Clay Christensen of Harvard, who spent nearly 15 years developing an insight and expertise on why do great companies eventually fail to innovate? Why is disruption inevitable? So we'll use that framework. But to do that, we'll make a distinction between 2 important ideas about the customer value proposition. And those ideas are delivered needs and latent needs. And let me explain that by this graphic that originally is something that Professor Christensen used, and I've adapted this in my own work. What this graph shows you is that think about a product or a service or an offering and its performance improvements over time. No company stays where they are. They make improvements in what they offer to customers. Now, most incumbents, those who have been entrenched in an industry, they have a good understanding of what the customer needs, and they deliver against those known needs. So I call that delivered needs, meaning that there's no secret about what the customer wants. All the incumbents know that, they share that knowledge, and they try to outdo each other in how they deliver. Because there are no new secrets, this performance incrementally improves over time. There are no major improvements. There are incremental improvements. You might build a better process for welcoming patients. You might build a better process for their payments, a better process for after-treatment care. But those are incremental because the knowledge is very quickly shared between incumbents. Now, Christensen's point is that in every industry, there are blind spots. There are latent needs. There are customers whose needs are not being served, either because the incumbents don't know about them, or it's simply too expensive to serve given the optimized business model. Or third, it's not profitable enough. So you could think about examples in your own industry. It could be that patients who want to take on a greater ownership of their wellness and treatment, and the traditional healthcare system is not geared for that sort of a co-equal partnership. Or it could be patients who are looking for a more patient-friendly billing and payment system. The point is that there are pain points in every industry. The most classic example that I use is, if you remember, in the entertainment industry, Blockbuster had a very good business model, and they were the dominant video rental company. They were everywhere, 2,000 stores, and you could walk into a Blockbuster and find the movie you wanted. The challenge with that model was they could only store limited inventory. And as a result, if you were the 10th or the 11th person walking in, searching for a movie, the copies were all gone. Then you also had the problem of the late fee or the fine, because that's the way in which they manage their inventory. So along comes a startup called Netflix, which says that, why do you need to go to the store when we can deliver your movie to your home? Secondly, you build a list of your movies and we'll send them to you so that your weekend is not simply anchored on that one movie you wanted to watch. Third, and I'm an example of that, if you have the time hanging in your hands, you can binge watch. You can watch as many as you can, because every time you finish watching and you send it back, we'll send you the next one. This was the model 15 years ago. Movie in the mail. So they were essentially catering to a group of customers whose needs were not fulfilled, because Blockbuster, as the dominator, all the other video rental stores, they simply could not cater to this segment. Over time, this becomes a disruption, because more customers, they start gravitating toward this latent need. And as we saw in the case of Blockbuster, within a 5 to 10 year period, Netflix became the dominant company. Blockbuster realized that its business model was obsolete, and their fixed costs were a drag on their ability to adapt and adjust to a point where what we call the crossover point, Blockbuster essentially ceased to be in business. Is this a unique story? Not so, because if you look at Amazon in retailing, or if you look at E-Trade in a brokerage, Uber, Airbnb, we are seeing that in industry after industry, there are latent needs, and it is becoming more and more feasible to discover what those needs are. So the challenge for every incumbent today is, are we blind to the sources of disruption? Are we so focused on the delivered needs because we are only looking at our fellow incumbents that we are not paying attention to the latent needs? So you may ask, well, is this true of healthcare? So let me point out a couple of macro trends. In every industry, including healthcare, consumer experience is brittle, it's fragile, and still in more of a state of dissatisfaction than in state of satisfaction. Industry after industry has found that consumers, on the average, not everyone, on the average, report a feeling of alienation, distrust, and lack of feeling empowered. Consumer preferences are changing. They want more of a relationship rather than a transaction mentality. And we are seeing a significant one-time transition in our demographics. We are seeing a transition from what I characterize digital immigrants. I am a digital immigrant. I was not born in the era of these technologies. I adapted and adopted. But my daughters, who are 21 and 25, are more of digital immigrants. They are the forefront of digital immigrants. For those of you who have children, 6 years, 10 years, 12 years, 15 years, they are digital natives because they were born with these digital gadgets and interfaces. Their mindset is very different. For example, in many sectors, the digital natives are less about asset ownership as they're about consumption. I need to put every song I like on my iPhone. My daughters say, you're crazy. It's available on Spotify. So that's just an example that we are seeing a shift from ownership to consumption and sharing. So how does that play out in different industries? Here is an example of a survey that I extracted about healthcare. So what are we seeing? We are seeing that ease of access to care is very important on the minds of the customers, but privacy is equally important, data security. But here's the interesting part, getting what you consider to be personalized care. Personalization is a sweeping trend across every industry. We in education are asking ourselves, what does personalized education mean beyond the degrees that we offer? So it's a question that leaders in every industry must ask. Having a provider who's close to where you live or work, cost, coordination among all my healthcare providers continues to be a source of frustration for patients, and I bet even for healthcare providers. Being able to monitor my health, taking advantage of the apps and the wearables, and somewhat of a virtualization access to a healthcare coach. I would say that some of these are examples of delivered needs, you know them, and others are examples of latent needs, which are sources of disruption and transformation. So, given this background, I'm going to offer you a new perspective of thinking about strategy and who should you partner with. So this section is based upon the work of one of my friends, Venkatraman, very nice book called The Digital Matrix. And if this conversation piques your interest, I'd certainly recommend that book to you. I'm not a sales agent, but it's a great source of very easy to read way of thinking about why digital transformation is an imperative in every industry. So what are the ways of thinking about it? First, that we are seeing in every industry the emergence of new players beyond the incumbents. The incumbents are the traditional leaders, but we are seeing in industry after industry, including healthcare, the emergence of digital giants. These are the large tech companies. They understand technology. They are born digital. They understand the power of digitization in addressing the latent needs of customers. That's how they enter the industry. They do not focus on the delivered needs because they realize that that's playing the incumbents game. But their focus is enhancing and enriching the customer by focusing on the latent needs. And I'll give some examples. But there's a second category. We call them the tech entrepreneurs. In the healthcare, we call them the med tech companies. These are new influencers who are startups who have an understanding of the pain points, specific customer pain points, and they are addressing them through digitization. Mark, did you raise your hand or was that a temporary thing?
Keep going. That was a mistake.
Okay.
Sorry.
So here's an example, and then we'll translate that to the healthcare industry. Think about entertainment. We know that the industry incumbents are the ones that essentially are your cable companies, the broadcast networks. Increasingly, we are seeing the emergence, the dominance, and the disruption posed by the digital giants, Microsoft, Amazon, Alphabet, Apple, Facebook, Netflix. We're also seeing the emergence of tech entrepreneurs such as Hulu and Sling, and there are a lot more examples. So what's the significance of this? The industry as you know it is not the industry that exists today. The industry is no longer just about incumbents. The challenge and the opportunity is to form partnerships. I call them new ecosystems of experiments and innovation with the digital giants and the tech entrepreneurs. In order to understand the healthcare, let's postulate, first of all, that these are some examples of what I would consider the key sectors of the healthcare economy. And you may have your own classification, but fundamentally, this addresses the clinical side as well as the business side of healthcare, and we can segment it in different ways. Applying this framework, here are some examples. There are a variety of incumbents, but today we know that Amazon continually makes experiments in the administration of healthcare, in the management of healthcare, not in the delivery, but in there. And they've had some experiments, some have failed, but they are anchored on the fact that they understand the power of digitization. Apple, with their wearables, they continually gain more and more patents. I understand that in the next 1 year, Apple is in a position to patent and implement in the next generation watch the ability to keep track of, for those who are pre-diabetic, to keep track of their blood sugar levels and get away from the invasive process that people go through of pricking their skin periodically and checking it. So that will be a game changer. Today, the wearables can monitor your heartbeat, they can monitor your vital signs, they can monitor your workout routine, and you can upload all of that data into your own cloud, or you can share that with your physician. Same way, Alphabet, Google, they're conducting experiments. So these are certainly examples of why one must pay attention to digital giants. I went and took a look at who are the emerging med tech companies, and you all might have your own list of med tech companies that you pay attention to. So as an example, Flatiron Health, Fisherback Health, two examples where they're focused very much upon streamlining patient information between the doctor and the patient. I call them the equivalent of fintech in the financial industry. Inado, they are trying to bring together cutting-edge medical research and make it accessible at the point of a conversation between a patient and a doctor. And the list goes on. So why should you pay attention to them? Because they are addressing the latent needs. They are important. They're not going to displace you, but they will help you in enhancing and enriching that patient relationship. So with that, I'm going to pivot to the next point of my conversation, which is how do you find these digital sweet spots? And based upon my research, I will say that there are 4 areas where you can probe for those sweet spots. Can you enrich the customer experience? Can you enhance your core operations within the hospital, within billing, within all of those things? Insurance processes that connect you with the insurance companies. Can you innovate new products or services? Or can you innovate new business models? So here is a framework contextualized to the healthcare industry about how can we find those digital sweet spots. Think about your value chain. Think about the activities you do. So here's a take on it as sets of activities. Primary prevention and screening, diagnosis and staging, treatment, surveillance, and self-management. And here are examples of where digitization offers you tools and processes for enhancing or enriching the customer experience. Digital tools to support the diagnosis, or building a patient-doctor relationship through connected or integrated devices. Tools for clinical decision-making, bringing the power of analytics. I talked about Inaro, so bringing knowledge about new treatments or therapies into the conversation, allowing the patients to do a lot more of their reading and research and be more informed in the conversations. Mobility, IoT have huge implications for bringing medicine to the patient rather than the patient to the point of care, always. Social media. Today, we are seeing a big proliferation of the power of social media, particularly among patient communities who are either terminal or at huge adverse care risk, whether it be cancer, diabetes, and so on, sharing their experiences, sharing their stories, helping each other out, and helping deal with the emotional agony of health issues. So very often these social media are organic, but just like every industry, the question for healthcare providers is, in the past, there was a big challenge of having a B2C conversation, firm to patient. And it was very difficult to create an opportunity for C2B, consumer to business, patient to provider conversation, as equally challenging to create C2C, consumer to consumer, patient to patient conversations. Today, how do we holistically create that platform and make it not just for emotional enrichment, but also for enriching the patient to provider relationship? So lots of digital sweet spots. That's not all. Whether it be in digital marketing, whether it be in customer experience, value assurance, and data, the list goes on. And I would bet that many of you on this webinar are probably experimenting. You will hear me use two words repeatedly, innovation and experimentation, and I will come back to those words when I wrap up my session, which is a good way to transition into the second part of my conversation is, well, how do you get to this promised land? Because it's not easy. So I call that, how do you navigate digital transformations? I'm going to start by putting forward to you an organizational change model, which is not new, but it has stood the test of time. And what it says is that technology is only a lever. Technology is not everything. The mistake companies make is procure a technology and expect that they will flip the switch and good things will happen. Wrong assumption. The mindset has to be organization first, business process second, technology third. It's tempting to do technology first and let the others take care of themselves, and that's a recipe for failure. So which tells us that navigating digital transformation is a much more deliberate and thoughtful process. What should we do? Always start with a business case. A business case is not just a permission to spend, but it is also a means to get people on board, to gain stakeholder commitment. No good business case gets made without people buying into it. And so that's a form of gaining stakeholder commitment. Spend time adapting the organization and the technology together. That's what we call configuration. Don't take a technology-centric mindset. Third, recognize that despite the best plans, the immediate outcomes will not be what you expected. There will be shortfall, and then there will be adjustment. Our research has shown that in large-scale implementations, there is an interim 6 months of adaptation and adjustment before you really capture the anticipated gains. Be prepared for continuous change to processes, data, training, and so on. And learn from every event, learn from every implementation, do the post-implementation reviews. These are some important lessons learned. It's equally important to recognize that transformation is a big agenda. It does not happen without the right tone at the top. A commitment to the what, the why, and the how. The business case is important. The chief information officers are not just technology providers. They are essentially organizational change champions. Are you measuring the right metrics? And I will end by saying experiment, experiment, experiment. Companies like Amazon and Google, one of their important metrics is how many customer experiments did we do this month? Not all experiments succeed, but experiments, regardless of whether they succeed or fail, teach new models. And that learning is the fundamental way to make progress. So let me stop here. And Mark, I'll turn it to you to see what kind of questions are coming in the forum.
Sorry, Samba, here I am. So yes, thank you so much, Samba. And I'll be looking for questions, and please, with that, we're going to open up for questions here. And again, you can submit those using the chat or the Q&A box. So Samba, one that comes to mind as we listen in here are, what are some of the common reasons why digitization efforts underperform or fail to achieve the outcomes or benefits that organizations are looking for?
I would say that there are a few reasons. They start first with, it is very tempting to take a technology first mindset that because we don't understand the change process, to trust that the technology itself will take care of everything and all. It's that to treat it like buying a new car or buying a new television set. It's not the same. Technology is really an enabler, but we often underestimate the amount of organizational change that is needed. Right. The second part of that is because when we underestimate that and things don't go well, we cut bait too prematurely. So there are many organizations which have panicked and cut bait, and then realize that there is only one way forward, which is organization, process, technology, and come back with a second effort. So today we have enough case studies to say, make the business case, because the business case will tell you all the needed changes. The business case will often tell you that we are not ready for this digitization. We need to go and reskill our people. So come to the University of Wisconsin and reskill. Or it may tell you that we need to create new roles. Or it may tell you we need to go visit organizations that have already done this. That's what we call the vicarious learning, the power of vicarious learning. So those are some things, again, to go back. Technology first does not work, even though this is about technology.
Great. So what would you say are some best practices? I mean, you talk about it can't be the technology first, but what are some of the best best practices in successfully navigating this transformation?
One of the lessons we've learned is digitization. The vision of digitization is a grand ambition. As human beings, we are not capable of taking on large, complex changes. So one of the lessons learned is dream big, implement small, or what we call the bite-sized implementation. So when you are thinking about enriching the customer relationship, dream big, but form those partnerships. Those digital giants and medtechs, they have spent a lot more time on the art of the new, whereas the incumbents are more focused on optimizing the art of the present. So are you talking to them? They are doing a lot of experiments. So how can you learn? So learning is the first important step as a best practice. Second, tone at the top, because organizational reskilling cannot happen without a commitment at the top. It has to be woven into people's work lives and a commitment to that they will have the slack to learn And the third part is a commitment to experimentation. Experiments by nature tells us that maybe 30–40% of the experiments will succeed. The rest will not, but they will teach us. But is our mindset about valuing risk-taking and experimentation as much as it is upon success? So those are challenges for every organization. They're particularly unique to healthcare because healthcare organizations are often navigating rapid, what we call the high velocity environment, meaning that they continually have to deliver healthcare. There's patients, there was the pandemic. So they have very little slack for paying attention to what's new, how do we make change, right? So it is difficult for organizations to manage the present and the future when the two are likely to collide with each other. So in research, we call that the ambidextrous organization. Ambidexterity means I can equally do well with my right and left hand. So how do you build such an organization? Example, Target. 10 years ago, they realized that the solution was to keep Target and create Target.com so that they could experiment here and keep the trades running. Walmart, Walmart.com. So what's the equivalent in the healthcare organization? It may not be healthcare.com, but are you participating in the experiments that Amazon or Apple or these medtechs are doing? That's an important best practice.
Experiment, experiment, experiment. So we've had a question come through. So in the pharmaceutical or medical device industry, the time to develop products is much longer than digital companies. So rewiring such organizations to be more nimble, like digital native companies, is a challenge.
Yeah.
So how would you recommend such incumbents sustain their transformation efforts?
Yeah, great question. You know, while I don't claim to be an expert in pharmaceutical, let me offer first an analogy from the airline industry, right? The average cycle time to design and build a new aircraft used to be 7 years because you actually built a physical prototype and then you tested it and then you rebuilt a second prototype and a third prototype. Today with digital imaging, augmented reality, virtual reality, the only plane you physically build is the final prototype. The rest are all digital images. So what's the digital equivalent in pharmaceuticals? A lot more. So from what I remember reading about the pharmaceutical, the three sources of the delays are, in no particular order, the voluminous and the extensive process of FDA approvals, that is documentation intensive. And today, technology allows us to manage documentation and shave that cycle time. The second one is the experiments and the clinical trials at scale. So how can wearables and augmented reality, those kinds of technologies help us speed up that process? Third one is analytics. Very often, when we are running experiments or discovering, it's based upon intuition. But today, analytics enables us to augment intuition with insights from data, collecting tons of large amounts of patient data. And then, of course, we have seen unique technologies such as the genomic sequencing and in the medical side. So how do we connect all of them? I would say those are three different ways in which we can crash. I mean, think about the COVID vaccine, how fast the industry developed the COVID vaccine and the promise that that kind of a process offers for the future of new vaccines. So that's where I'm very optimistic that we will see much quick cycle times in drugs to market.
Great, and thanks for the question, Stephen. So I have one more. So you had mentioned the desire of patients for communicating among providers. Although CMS has recently mandated the use of EMR interoperability tools, there's been a slow uptake of available EMR data sharing tools. So how do you recommend providers begin to address that issue?
Yeah.
That's a tough one.
It's a tough one. It's a tough one. But again, that's where just like the patients, you are the customers of the healthcare providers. And I know we've heard, whether it be Epic or other providers, that's where the community of healthcare organizations beginning to articulate their needs and form. I mean, this happens in most vendor organizations. I have experience with Salesforce, I have experience with Oracle, and so their willingness to, understand what are the interoperability needs and how do they do that.
Okay.
The cloud can be a solution, but again, there are limits to cloud solution in healthcare because the EMR is still the basic platform. But sometimes if you look over a sufficient length of time, your optimism returns. When I moved to Madison and I was expecting the worst in terms of the transition to the healthcare here after 18 years in Michigan, I was blown away when my doctor simply went on to his Epic portal and in one swoosh got 20 years of my medical data into his portal. So there is hope.
Yes. Yeah. All right. So we don't have any other questions. And I know that, folks are busy. We're coming up on the hour. So I think we'll go to the next slide, Dean. So thank you, Dean Samba. And before we end, I wanted to let you know that CPET is ready to help your healthcare organizations create a culture of innovation that harnesses emerging technologies to ensure your organization stays relevant in the changing economy. So if you're interested in learning how to embrace digital transformation and find opportunities for innovation, I'd love to set up a discovery session with you to talk about our custom consulting, coaching, and professional development programming and innovation and digital technology or digital transformation. And my email's on this slide. I would look forward to a deeper conversation and learning about more about your organizations as we start our laser focus on partnering in the healthcare industry. So thank you so much for attending today's webinar. Thank you, Dean Samba, and everyone have a great rest of the day.
Thank you, Mark, and thank you everyone for listening in, and look forward to any questions or feedback as we continue these conversations.